Taoiseach, I want to raise to you today the disgraceful and diabolical decision to close St Bridget's Hospital in Carrick-on-Shore just on a whim yesterday morning. On the 27th of April I raised this with you, on July 1st I raised it here, on August 11th, and in September and October, November. Last Sunday evening at 7:20 p.m. I got an email from Ms Barbara Murphy saying that they were looking at reopening it subject to the building being okay. It was the first time there was any question mark about the building. What kind of deceitful? I call it stronger if I was allowed, but I don't think I am. But it's untruths. Were given to us here. Councillor Kieran Burke, a hard-working councillor in the town for years, and his family before him, came up here and met Minister Donnelly. I think he's here, Minister Donnelly. He was here earlier, and promised them would be reopened. I have commitments from Minister Harris in this House that it would be reopened. I have commitments from Minister Donnelly, and so have the people. A hard-working local committee are there now working together, trying to make sure this is reopened. The local community of Carrick-on-Shore, indeed South Kilkenny and East Waterford and South Tipperary, fundraised hugely to put in 3 hospice beds there. The staff in that were exceptional. All the staff, from the caterers to the nurses and the palliative care teams that came in that nursed in those hospice beds. We only have 2 other hospice beds in South Tipperary in a wonderful facility in Clogheen, 30 miles up the road. Where are the people that are going to go? To hell or to Connacht? This is outrageous that a HSE could treat people like this, and the Department of Health. Oh yes, they're having a meeting with us TDs this evening to tell us about it. I mean, we have replies in writing for them, and we can't believe a word they tell us. What kind of a shameful way to do this under the auspice of COVID? First of all, they needed it. We accepted that. There was no need ever. I don't think any patient went in for COVID step down. But a huge amount of patients have been denied step down and recovery time because it's closed to them. But above all, the hospital patients and the families, I know some of them who couldn't get access to it and they died at home, supported by the hospice in Tipperary, who are excellent. But this is shocking. The hospital is there since 1835 or 1840, and it has generations. Many Carrick people were born in it. But to treat the people like this, you have a new health primary care centre almost in front of it. It costs 10 million, which is less than 50% occupied. And you're telling us now you want this for community care. This is deceit. It's a blackguarding on the people of Carrick-on-Shore and surrounding districts, and it's not going to be accepted by me for one anyway, or by the hard-working committee there, and Catherine and indeed Eddie Reid and many more of them, or by Councillor Kieran Burke, who came up and met the Minister. What can we have in our politics and democratic system if a minister tells you in writing and to your face, as he told Councillor Kieran Burke, that it would reopen? And now just summarily disclosed. Who's in charge of the HSE? They have too much power and they've done wreck damage to us, and they weren't fit to handle the COVID crisis. They're not fit to handle anything. We lost Tipperary Community Hospital in '87. We lost St Michael's mental health beds as well under so-called Vision for Change, and we got nothing in return. We're lucky to have saved Clogheen and thanks to former Councillor Con Dunham at the time for saving that, when we had health boards and we had accountability. There's shockingly no accountability in the HSE and the Department of Health, and the money that they've spent in this, there's a new lift in it. Minister Butler told me yesterday there was no showers upstairs. There are, and there's a new lift in it. So they're using HICWA now. They wheel out this vehicle of HICWA, who are not fit for purpose either, when they want to do damage and destroy a community, destroy a wonderful facility that is needed, and it was fought for by the people. And I tell you, Taoiseach, that this will have far-reaching repercussions, and we want it kept open, and this decision has to be reversed immediately.
Thank you, Deputy McGrath.
Thank you very much, Deputy. I spoke to Minister Butler and Minister Donnelly about this earlier today, and I'm happy to set out the current position to the House this morning. St Bridget's Hospital is a short-stay unit with 16 beds, including 3 palliative, 2 respite and 11 convalescent beds. The HSE operated activity at the hospital and the design and layout of the hospital is largely reflective of a small hospital from the time period in which it was built, that's 1837. In March, admissions were suspended and it was designated as a COVID-19 step-down facility. Arrangements were put in place for patients requiring convalescent, emergency respite and palliative care to be accommodated elsewhere in the HSE services in South Tipperary. With regard to St Bridget's Hospital and its infrastructure, having considered the current infection control advice, it is with regret that the decision has been made to discontinue short-stay services at St Bridget's Hospital in Carrick-on-Shore. Unfortunately, I'm advised by the HSE that it is no longer feasible or sustainable to continue to operate St Bridget's as a district hospital, given the layout of the premises, the narrow hallways, the inadequate space, the facilities available in the 2 5-bedded wards, and the risk of cross-infection. With regard to the premises itself, it's now proposed to use it as a base for the newly created community healthcare network in South Tipperary, along with serving as a base for members of a chronic disease management team with a particular focus on diabetes. It's ideally located adjacent to the primary care centre, and co-location of these buildings will enable integrated and multidisciplinary working. So repurposing of St Bridget's will provide the HSE with the opportunity to develop community healthcare services in South Tipperary for the better, with a particular focus on the management of chronic diseases like diabetes.
Thank you, Taoiseach.
That's a typical reply, a waffle from the HSE. Why wouldn't we told that in the email I got at Sunday evening, 7:26? Taoiseach, the wonderful staff that are there have been deployed elsewhere for COVID, and they put their shoulder to the wheel, and are in the surety that they were going to be sent back there. The building, you say, might be old. It's a pristine building with a new wing on it for the hospice some years ago. And this will be standing when many of the prefabs now and these ready quick builds you're putting up will be rotten and decaying. This will be standing. And we want the people to be able to use it. And the people of Carrick and Shore are proud people. They've got nothing, only kicks from this government. No factories, no support, but they're not accepting this. And indeed, Catherine, who I spoke to this morning, is pushing the bed to Dublin next week, all the way from Carrick and Shore. And one of the activists, non-political person, and Councillor Ciaran Brook will be fighting as well, might and may, as I will. This is wrong. Why do you stand up here reading out balderdash from the HSE? You're supposed to be in charge of the Taoiseach, and the Taoiseach told us as well. And you take this, just hive off and blame HICWA then. HICWA not fit for purpose anyway. You heel out HICWA, or wheel him out when they're ready, when you want to do something disastrous. The dishonesty and the deceit that was perpetrated on us, public representatives, and the people, is shameful in this. And that's why politics is the way it is in this country. All you want is big jobs and powerful and big positions. And to hell with the little people. I tell you, the hell little people will rise up in the spirit of CJ Kickham in Tipperary, and they won't accept this from your so-called coalition.
Deputy McGrath, thank you. We just reset the clock. The clock was malfunctioning there for a little while, but I was using my stopwatch. Taoiseach, 1 minute.
Thanks, thanks, Deputy. There's one thing nobody would mistake you as a little person, Deputy McGrath. You can be sure of that. We all recognise your stature. In relation to the questions the Deputy raises, I'm advised by Minister Donnelly and Ministers Donnelly and Butler that there are currently no residents, no patients in the hospital. They're all being catered for elsewhere in higher quality, more modern accommodation, and the staff have been redeployed. There are no job losses. Following some minor works, 7 whole-time equivalent staff members will initially be based at St Bridget's, including the following: a CHN network manager, an assistant director of public health nursing, a clinical nurse specialist in diabetes, a dietitian, both a senior dietitian and a staff dietitian, and also 2 administrative staff. And a podiatrist will also be there to provide in-reach services at St Bridget's. So while it is regrettable that it's no longer feasible or sustainable to continue to operate St Bridget's as a district hospital in the way it was in the past, as part of the modernisation of our healthcare service, this building is going to be repurposed to provide chronic disease management and better diabetes care for many more people than are currently receiving it in South Tipperary and indeed the South East. And overall will represent an improvement in healthcare services in the area.